Thank you so much for joining me today, Dr. Rigert. This week we have a very special guest. She is a oral medicine physician. She has a fascinating story, life full of trauma, but she came out of it and now she's doing big, wonderful things. So I would love for her to share her wonderful journey with all of us, and we can definitely learn a lot from her. So welcome, Dr. Rigert.
And thank you so much, Dr. Gia. I can say the same thing with everything that you're creating for researchers like myself. So I'll give people a little bit of a background story. And so my story is that I started my professional trajectory as going a fast line into oral and maxillofacial surgery in the Air Force. And I say a fast track because I actually did a 3-4 program in undergrad and selected dentistry as an 18-year-old. And so when I did that fast track, like a lot of us who do a very linear approach to our training, kind of put your head down and you do what you need to do in order to get to that next step of your training. So when I was in the Air Force and oral surgery, I was really starting to question things. I wasn't sure exactly why I was feeling so unsettled. But during prolonged times of forced sleeplessness, I was developing a lot of suicidality. And so that kept making me rethink, am I on the right path for me? And during this time, I had a lot of losses close to me, and I was coping with anorexia. I was using anorexia to cope, and it helped numb me out, and I became very medically compromised from that. And so when I was in the hospital for anorexia, I was like a normal physician that doesn't want to stop and process. I was trying to calculate, okay, if the Air Force kicks me out for this medical complication that I'm having, what are my next steps? And I literally decided to start interviewing for the potential of my next career path while inpatient. And I share that part of my story because a big part of what I help people with now is when they're in burnout and suicidality, to really take a step back, reset, and pause and not do what I was doing, especially if you're experiencing a lot of grief, which can come from the form of identity loss, personal loss, and what have you. But I did end up getting medically discharged from the Air Force, and I went from oral surgery, handing over my resignation, to the next day starting oral medicine residency. So a lot of people don't know what oral medicine residency or oral medicine is per se. And so for the people that don't know, it is a specialty in dentistry, and it really is kind of that liaison between dentistry and medicine. We do a lot of rotations with internal medicine, rheumatology, psychiatry, cancer, which is, I say that because it became a big part of my career. And during that time point, I was really starting to feel like where can I have the most benefit? And my program is very research heavy. My chair was trained at NIH, and everything we did was research. It was how can we improve what we're doing now? And I love that. I love that we were always wondering, like, this is what we're doing, right? This is kind of what the current standard is accepted right now for treatment of this condition. How can we improve it? And we did a lot of patient reported outcomes, which are very key to the importance for me, because when I was being treated for anorexia, I felt, I don't think that they're targeting the right thing. Like, I needed a say in the treatment. I really wanted to be part of improving the treatment. So I wanted to offer that back to the patients I was treating in oral medicine, who came back oftentimes with severe discomfort. For the cancer patients, if they had radiation, can have such severe dry mouth that they become suicidal. So as you can see, this starts to tie into, I was suicidal, I don't want these people to be alone, and I want to do something about it. And I still didn't know exactly how. I was like, where do I belong? Where can I be the most benefit? And so I did 1 year as an attending in hospital dentistry during COVID. And I think COVID happening and kind of having us all step back out of clinic, especially as you can imagine, hospital dentistry treats medically complex patients, and dentistry, which is very top profession to get knocked when COVID came. It provided me the opportunity to really pause that I didn't provide myself years prior. And I was fortunate that oral medicine's a really great family, and they provided me some options to consider for my next steps. And my current role, I'm currently a postdoc research fellow in radiation oncology at a cancer center, that information was provided me from my chair. So kind of just took a chance that it would be a good fit, and I moved across country to start full-time researching. And I kind of fell in love with the idea of the impact we can create as you as a researcher when we dive into these things and we say, like, what are truly the problems here and how can I be part of the solution?
So I love how you have included your personal experience as a patient to research, because sometimes research, we love to look at only the numbers. We
Mhm.
choose whatever outcome we want. And now you're looking into from your own perspective that, weight is not the most important outcome. It's how the patient feels, because that's what drives what patients do. When you first got into research, it was new for you. How did you ease your way through it? How did you get into it?
Well, I'll say research is when I reflect back on like childhood, I was always the science experiment kid. And I realized it was a very natural part of my over analytical was my analytical brain. I was always told I thought too much and I was obsessed with numbers. It was part of my anorexia. I was obsessed with numbers. And I thought, wow, research would be a great way to utilize that obsession for good and take the data and see if it's meaningful. And if it's meaningful data, then it becomes information, right? And if it's whatever, you have that whole hierarchy of importance when it comes to data. And I was like, wow, this is the first time in my life I thought I could take what was causing such tragedy in my life with anorexia and very hyper-focused analytical mindset all the time and number focus. I'm like, wow, if I actually put this into research, I can use this energy for good. And so I got really excited. And so I was researching in dental school, even though my dental school, we had very low resources when it came to research. And I used those resources as much as I could. I was like, well, I'm going to do whatever I can with these limited resources. And I found that became my sanctuary. When I was in dental school, I was told I was misunderstood. And I don't know exactly, I was very much dedicated to my patients and my schoolwork. And I think I had a hard time balancing that with social, I kind of like all or nothing. I was like, I have to do this and I have to focus on this. So then it limited my social interactions, which of course, if people don't see you, they don't, they can say whatever they want about you. I'm like, but really I was with the rats cleaning their cages and like, just that became my sanctuary. I was like, wow, I really enjoy this. So I didn't know at the time that I was introverted because my whole life I was kind of masking this. I had this very extroverted type nature. It's involved in things. And so going from dental school into oral surgery, we didn't do so much research. But then again, in oral medicine, where I had a chair who was research heavy, and I really enjoyed that aspect of his brain where he's constantly spinning. What can we do? How can we get data that's meaningful? And when we think about burnout, I thought when I was getting help, I didn't call it burnout at the time. I didn't have a name for it. I was just suicidal. And I was like, wow, like we can name these things, but do we have real solutions? And in order to be part of creating solutions, I think we have to be able to be embedded in the research and understand if the data collected is meaningful. So with that enthusiasm, I felt research was a good fit for me. I will say when I started and when I think a lot of people shy away from research, not only is there a thought that, you don't get the compensation for the amount of agony that it can cause, but it's mystifying about what is this grant? How do I apply? And it can be very overwhelming. I was very fortunate that my mentor is very much fluent in writing grants and also very open about we write all these grants and here's the expectation about ones that get accepted and here's how we cope with that and we pivot and we create things and submit again. So I had already had the mindset that set the expectation that it will get rejected, and if it gets accepted, that's a celebration. If it gets rejected, what can we learn and modify? And also in that, I've learned that with the ability to be perseverant in the face of expecting a lot of rejection, I've learned that if I go in with a passion for things, same with entrepreneurship or anything, like if I believe in me and I believe in this project, then I'm much more likely to get back up and try again. Versus if I was like, I don't know, this sounds good, I submit, it gets rejected, then I might be easier to say like, all right, screw it.
So many gems in this short amount of time. So what I hear is a few lesson points for everybody. First is being obsessive is not wrong. I think being obsessive and passionate about something, where to a point where I love doing the numbers all the time. Let me focus and use that as a strength. Sometimes is what brings you towards the next level. So that was one thing I learned from you. Second was the idea of rejection. And yes, research has a lot of rejection involved, but if your goal is big enough and your passion is big enough, all the obstacles pales in comparison to the goal. So I love the whole story about picking up again and even thinking about entrepreneurship, because that is the same. A lot of rejections, a lot of downs and ups, and research and business are actually very, very similar.
Yeah, definitely.
Right. I want to ask you, What are the struggles you had changing your identity?
Mm, yeah, that's a great question. It happens so often is that there's a lot of loss, a lot of grief that I felt when I was trying to let go of an identity that kind of feels like a cloak, right? It keeps you safe. And I just felt very lost. Who am I without this title? And after a long period of time of going through the grind and doing things that society told me I should be doing and ignoring oftentimes things that I found to be fun. Like I wanted to be a psychologist and I really enjoyed a lot of different aspects of my undergraduate training, but I ignored a lot of the things I thought I could have found more joy in. Because at the time, I thought I needed to justify my existence by grinding as hard as possible and proving that I was valuable through some sort of prestige or hard work or something. And when I ended up getting to a point where I started to question that, is like, who am I without the Air Force? Who am I without being an oral surgeon? And who am I with anorexia becomes an identity for many people. Who am I if I start to heal from this? And I was very empty inside. And so that's a very uncomfortable spot to be in. And so what I learned about myself 5 years later is that I didn't sit with that. I did another residency immediately after, which turned out to be a great trajectory for me, but it was to be so busy that I couldn't sit with that discomfort of processing. So what I did that ended up to be a very positive experience was I dove into multiple different healing modalities, therapy, psychiatry, coaching. I'm going to be starting doing equine therapy and I have a shamanic healing. It's like I just tried all these different outlets to try to learn how to express myself, to feel again, and to have people that can help guide you through those really uncomfortable experiences. And you talk, a little bit about where I'm at now with, I have multi passions, right? To try to reinvent myself and figure out who am I really? And I think the same thing happened when I was really feeling lost in our Western healthcare system. I was like, I do not belong here. But there are aspects where I do. There's aspects I really enjoyed, such as like the integrative health and things like that. So I think at first, when I was letting go of those identities, I felt, I deal with depression now and I still try to do things that are not meant for me. And I got really down. And I did Martha Beck's Wayfinder Life Coach training, and she does this thing called the Body Compass. And she wrote a book called The Way of Integrity. Those things were essential in my understanding of how we can really tune into ourselves in order to understand what aspects of our life in our alignment with our true integrity and what aspects of our life may need to be changed.
If, let's say, if anybody in the audience, like they have to let go of their identity, maybe talking to you yourself 5 years ago, what would you advise that person?
Yeah, I think it really depends on their support system and what exactly they're seeing at the time. So the first thing I would do if I were at that place where I was losing my identity again, just really stepping, I kind of like to go back outside of all the societal expectations that we're surrounded by, and to really, if we're sitting in silence to really try to just reset, that would be my first step that I definitely neglected when I went from surgery to then becoming more busy. And when you are in that state, the risk and why I hesitate a little bit is because when we get to that state, like I was not okay, like mentally not okay. So I really had to have a community that I could rely on in terms of support, people who could be there for me when maybe I couldn't yet be there for me. We like to say you can have your own back. There are periods of time in your life where you're just so exhausted and you're so lost that just having compassion around you to allow yourself to take a step back and heal and to have grace for yourself, I think that would definitely be my first place to start.
Oh, absolutely. Because we sometimes want to do everything ourselves and we think we can get out. The support system help. Asking sometimes is the best thing that we can do for ourselves. Absolutely. Now we're going to shift gear a little bit, and I want to hear more about what have you been doing for the past 2 years? You've been doing very, very exciting things, multi-passionate. So I want to hear more. What have you been up to?
Yeah, so my primary role is a postdoc research fellow in radiation oncology. So really trying to figure out my role to improve patient quality of life by reducing their radiation attributable oral health outcome. So that's really focusing on prevention, improving patient quality of life, and kind of post-radiation treatment survivorship. The other thing is when I got to my institution and I was still struggling with that, we don't have a lot of tools to help with burnout. There's a burnout committee And I went to my chair and after this burnout committee that he was helping to lead, and I said, I heard coaching is really great for burnout. I hadn't yet started my program yet. I'm like, I'd already signed up for Wayfinder. I'm like, can I bring this to our department? And he said, actually, we already have it in our institution. And I was like, oh my goodness. And they helped me to go through Coach Rice, which is a coaching program. It was phenomenal. And I became a coach within the institution, which was so meaningful for me. It helped my growth, and then I can give that back to individuals that are within the institution at all levels. So I'm really impressed with that aspect of my institution. And they also have an integrative medicine center. So I'm connecting with people who are all similar minded, and it makes me really excited. And then also with the transitions. So when I was in surgery and coping with anorexia and not socializing, YouTube was my community. So I always wanted a YouTube channel, and I was never physically well enough to feel I should be on camera until this past year and a half, where I felt, okay, now is my time. And I get the opportunity to bring people on the channel who get to share their stories, what they're up to today, and how people can connect with them, which is provide me a lot of, it warms my heart, and it's provided that supportive community that we talked about. And then also I write for some blogs. So part of my healing process has been writing. So my story, if people want to know more, I wrote on Kevin MD, and that has provided me, once I wrote that story, which was where I carried all of my shame and guilt about oral surgery and leaving it. I wanted to hide and not tell anyone ever, but I just threw it out there on Kevin MD, and that has brought people into my life who have been in that community that I talk about. Like, please find that community that sees your pain and say, hey, me too, and I'm going to walk with you through this. Because that's just been so important in getting involved in aspects of my core identity that were truly me versus hiding and trying to put that mask on. And I have a cup here. It says, what would Brene Brown do? And I moved to Houston, which is exciting because everything Houston reminds me of Brene Brown. And I'll be doing a TED Talk. So that
congratulations.
Thank you. Yeah, so that TEDx talk, I should say. But that led me to a group where people are using their voice when we've often been silent. So, it sounds like a lot of different things, but it's all kind of under the umbrella of the same thing. Like I went from, we feel oppressed, we feel like we couldn't be ourselves, and now I'm just going to be myself, because our lives are so short, and it's so important that people understand that they have very unique gifts to share with the world, and to start embracing those gifts.
Oh, beautiful. And what I really love about the things you're doing is you're not censoring yourself, you're just doing it. And you are allowing yourself to have the opportunity come with you. And because you put yourself out there, because you wrote, and when you write, you're thinking. And when you're thinking, you're healing. So I love writing too, because it's my way of thinking. And I think even in research writing or creative writing or non-creative writing, it is a therapeutic for a lot of us. And I love that.
And I often find people think they hate writing because they're judging themselves on their ability to write. So I would say start with writing for yourself, and like the judgment. Writing is art. Not everyone likes the same writing, and you never know. So similar with your journey, with your journey towards your writing, how many more people you can reach through your writing, and then teaching people to write.
Right. Because when you writing is good in different ways. Like research, we move science. In the blogs or all the stories you share, it moves people's lives. So they are all very powerful. So I want to say thank you so much for this wonderful talk. Learned so much, so many gems. And how can people find you? And what's the best way to connect with you?
Yeah, the best community I really would love people to join is the YouTube community as well. I know you have a great one. So come on over. My YouTube channel name is just my name with my credentials. So Jillian Rigert, DMD. You'll see my co-host, which is my dog, Reese.
Very cute.
Yes, and you'll meet a whole lot of people that share their stories. We'll have Dr. Gia on there, so you will see her there too.
Wonderful. And I'll put the link in the description so that you don't have to search for it. All right. Thank you so much.
Yep. Thank you so much. And thanks everyone for being here.
Bye.
Bye.